Hi, good evening. My name is Desiree, and I'm going to be talking about kidney stones. I use an article called Kidney Stone Disease, an update on current concepts as my source of information. Now, signs and symptoms of kidney stones. You have nausea and vomiting. You have renal colic, which is an intense cramping pain in the abdominal area. And you have hematuria, which is a blood-tinged urine. You can also have UTI signs and symptoms as well, such as frequency and urgency. Now, these signs and symptoms depend on where the stone is, if it's in the kidney, the ureter, or the bladder. Now, who is more prevalent in getting kidney stones? It does not discriminate against age, race, or the sex, but research shows that it's more prevalent in men, and especially in ages 20 to 49 years old. Now, you also have those who are a lack of physical activity, your dietary habit, and also your genetic inherited disorders such as a family history, a gene called RBAT, which is unable to filtrate cystine, can cause kidney stones as well. Now, how is the stone formed? So blood passes through what is called the glomerulus in the kidney, and it passes where we're making urine, filtrated and absorbed. Now, urine is consisted of water, urea, minerals, salts, hormones, and enzymes. And then sometimes when being filtered, we're going to reabsorb the amino acids, proteins, bicarb, calcium, phosphate, and potassium. Now, when the kidney is not unable to filtrate these properly, you can get stones. Common stones are calcium stone. It makes up 8% of cases when a patient is hypercalcemic, too much calcium. You have the second stone called struvite, or it's called magnesium ammonium phosphate stone, makes up 3 to 10% of cases. This is when chronic UTIs for patients occur and your urine is very alkalinic, making your urine being concentrated. You also have uric acid stones as well, or they call them urate. This is when your diet consists of too much purine, such as meat and fish, causing stones. Then you have cystine stones, which is less than 2% of cases. This is when you have an autosomal recessive gene that I had mentioned before, where you're not unable to secrete cystine. And lastly, stones can be created from drug-induced. This is less than 1% of cases. This is when the patient is either taking guanfacine or they're taking sulfa drugs, or also atazanir, which is a very popular HIV drug. These medications can predispose you to have kidney stones. Now, the formation of the kidney stones, of course, depends on the pH, the concentration, and they have the crystallization, which makes the stone. Now, popular tests that are used to diagnose kidney stones, the golden one is CT scan, computerized tomography, but you can also do abdominal x-ray to rule out any other abdominal issues. A KUB, which is a radiograph of kidney, ureter, and bladder, is popular. And of course, your lab work, such as a CBC to detect bleeding and infection. You get to do electrolytes, a serum creatinine to test the kidney function, and a C-reactive protein is a helpful marker as well. Now, how do we treat them? First, medications such as NSAIDs, such as Advil or ibuprofens, is the golden standard. If you can go away from opiates such as morphine, which would be helpful. Plenty of IV fluids. And sometimes the doctors will give diuretics for patients who have too much calcium. And also a popular drug called alpha blockers. Popular one is Flomax, helps relax the muscles in the bladder to help remove the stone. If the patient cannot remove the stone themselves, then they'll have to do a procedure or a surgery. Popular one is a ureteroscopy using a lithotripsy, which helps break up the stone using shock waves. And then the urologist can go in and put a stent where the stone can pass through the ureter just fine with some help with the patient. If they can't do it internally, they can do the percutaneous, nephrostolithotomy, where they'll have to go in from the outside in as a surgery to remove the stone. Now, during this process, it's very important to strain the urine. Straining urine will help the patient find the stone if they do pass it on their own. And then after that, the treatment when they go home, change of diet, plenty of drinking water, and also following up with their primary care doctor or urologist to try to prevent future stones. Thank you.